community station. This is Bobo FM. The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
Welcome to the show. It is Bobo, and I want to thank you for being a part of today's show, all brought to you by HSA. And as always, we bring individuals in the studios, could be doctors, nurses, maybe professionals, anybody that works in the admin area in HSA. It's their show. It's dedicated to them. And today we have a very special topic. Before we get into it, I would like to introduce our guests. So we'll start for, I guess, because I would say ladies always start first, but there's two ladies in the studios today. So we'll start with anyone that wants to introduce herself first. Go ahead.
Hi there, my name is Holly MacKenzie. I'm a registered respiratory therapist and certified respiratory educator, and I work with HSA.
Holly, by the way, before we move on to our next guest, you know how many times I stood in the mirror trying to say what you just said? It is frustrating, man. Like, isn't that like the one thing that you guys do when you go to medical school? At least try to get the words right? I feel like that's what it is. All right, our next guest, please.
And I'm Karen Stewart, Senior Nursing Officer. I also oversee the pulmonary the respiratory therapy unit. Yeah. And so that's why we are here today to talk about pulmonary rehabilitation.
Yeah, I couldn't get a job with you guys. It'll be difficult every day. I'll be nervous to say those words. But good on you guys. Thank you so much for being here in the studios today. The show is all brought to you by HSA. And what I want to do before we jump into the program that we're going to be talking about is, of course, just to talk about a little bit about yourselves first and how you got into the medical field. So we'll start with you, Holly.
Okay, so I've been a registered respiratory therapist for 16 years. I'm from Nova Scotia, Canada. I've done a lot of programs like the Pulmonary Rehab Program back in Canada. So I was excited to be able to bring it here with Nurse Karen. And I've been on island just a little over a year now.
Oh, wow. So still new to the island. Yeah, that's good. How do you like it so far?
I love it. Absolutely love it. The patients are great. And love the lifestyle.
What's the difference between, if I can just jump into this, between where you're from and working here in the Cayman Islands?
There are many differences even in like healthcare and the disease processes that we see. There's a bigger focus on like educating patients at home to so they can take care of themselves at home back in Canada, because in healthcare they tend to wait a really long time to be seen by doctors. Where here in Cayman, you can pretty much get in right away, which is really nice.
It's always good.
Yes, yeah. Absolutely.
Yeah, I seem to think that we have really good medical programs here.
Definitely.
And you're no stranger to the island. You've been living here for how long now?
17 years.
17 years.
Yes.
This definitely beats a year. Well, tell us more about yourself and just how you got into the medical field.
So I am a registered nurse. My specialty is critical care nursing, which has to deal with all those patients who are on life support machines. Mm. And I am a registered nurse now for 32 years, so quite a long time. 17 years of that I've spent in the Cayman Islands as a nurse manager first to the critical care unit, and then into this role as senior nursing officer. And as I said, I oversee the respiratory therapy unit, and so I work hand in hand with the respiratory therapists to try and provide the care that our patients need, and they're always appreciative. Yeah. The wait time, as Holly says, we try to make that wait time very, very short. And so yes, also in terms of respiratory, if you in the intensive care unit, we utilize the respiratory therapy clinical expertise a lot in that area, because that's also a part of their area. Yes, anything to do with respiratory. And so it's very, very nice that we're able to bring this program.
Yeah.
We already have a cardiac rehabilitation program at the HSA. And so that deals with cardiac and really helping those patients. But this was lacking. So, the previous respiratory therapist, and I have to say a big shout out and thank you to Rachel Nesbitt, anywhere she is, and I hope she's listening. We actually worked together on this program for several years, and then it is just coming into play now. And Holly came just in time to take over, and that has been great. That Holly, Rachel, and other persons work along to really bring this program along.
I love it.
So it's all about the patients. We really want to improve their life.
I love that. And it is, you did say that, just want to take it back to that. This is a new program.
It is a new program.
So brand new to the island. How long has this program been going on, if I missed that? How long has this program been involved now on the island?
From December the 2nd, 2024.
Okay, wow. All right, so give us an overview. Like, for those that are just driving in a car, they just heard the interview. Tell us more about the program and just a brief overview or a long overview on what this program will entail.
Okay. So the Pulmonary Rehab Program here, it's a 12-week program that's run for patients with stable chronic lung disease. So that could be anything like COPD, pulmonary fibrosis, any stable disease that causes shortness of breath. So significant shortness of breath would be like if you're short of breath going up a hill, or if you were to rush, or you're having difficulty with activities of daily living at home.
Yeah.
So the program runs for 12 weeks. It's three times a week. They do exercise, supervised exercise with us. And then a really important part of the program is that we do education with them once weekly. And that could be to go over medications, how to cope with exercise, what's pushing yourself too hard, things like that.
Is somebody be concerned that's walking out, like, for instance, you guys just came up our stairs here at the radio station. If somebody's always out of breath coming up those stairs, should they be concerned about that at all?
Yes, they should be.
Okay.
And I would say to them, that's when you would visit your physician, for them to maybe do further tests, on you to see why that is happening.
Yeah,
That's
because
not very normal.
it's not.
No.
So somebody doesn't just blame it on, I'm just out of shape. I'm in my 40s now. I'm 41. I'm just out of shape. That's what because a lot of, I'm going to be honest, a lot of Caribbean individuals feel that they're doctors already. So they're going to come up the stairs and be like, I'm out of breath because I'm in my 40s. So I'm going to get over it, or I'm going to go to the gym and go on the treadmill 30 minutes a day.
Right. So it's not a standalone. It's not a one standalone thing. So you have to be mindful of that.
Yeah.
You could have had a very tiring day today. So coming up the stairs could just be very tiring. But if this is something that is persistent, and especially
If it's progressive.
If it's progressive, then you want to just take that note and just to ensure that you're okay.
Yeah.
Just visit your physician just to make sure that there's nothing happening on the line that you're unaware of.
Intriguing, man. Intriguing. And what could be, I hate to ask this, but I think this is what our listeners want to hear. What could be some of the issues that could cause that? Why those individuals are walking upstairs and feeling they're out of breath?
There could be several things that it could be. So we would want to do tests to rule out.
Yeah.
Right. So if there's a significant smoking history, there could be something there. Any aspect of restrictive lung disease, which we would do a pulmonary function test for that, a breathing test. There can also be cardiac factors that are involved with getting shortness of breath coming up and down the stairs. And it could just be lifestyle modification, but you want to get those tests to rule out so you can come down and, okay, maybe this is, and then you're cleared to have the exercise program once you've had the tests. Right?
I love that.
Yeah.
You know what I've seen before, guys, is I've watched people that are just sitting around and you can hear them breathing. Mm-hmm. And that's always concerned me. I've always looked at individuals and be like, I think you need to get that checked out. I'm one of those that what is in my head comes out of my mouth. So a lot of the times I'm like, hey, you're breathing pretty heavy. I think you probably need to go to see a doctor. So I'm so glad that you guys are here in the studios because I never really felt like I knew who do you go to. There's so many different doctors out there, but who should you personally go and see just to cut the time in half? All right. So why is this program important here for Cayman now? Why do you guys think that this is a very valuable program?
So there is a growing need for better management of chronic respiratory conditions in the Cayman Islands, and this is not just in the Cayman Islands, but all over the world. And so we had limited options before. So prior to this, persons just go to the physical therapist or the physiotherapist, but they although that was beneficial to a certain point, it didn't cover everything. It didn't prevent them from readmission, whereas this program, one of its aim is to prevent that. So those things are very important. Yeah. So this program will benefit both the patients and their families, and also to the healthcare system by improving their lifestyle and improving their life, but also reducing patient readmission or admission to the hospital. Nobody wants to be in a hospital when you can be home.
Yeah. It's a really good program from what I'm hearing so far. And also, for those that are just tuning in, one more time, can you just tell them more about the program? Because there might be new listeners that are coming in. Just a overview, just a quick short one.
Okay.
Yeah.
So it's a 12-week program that is run for people with chronic lung disease, stable chronic lung disease, and it's helped to encourage socialization and gain valuable knowledge about their lung condition. It's supervised exercise 3 times a week and 1 weekly education session, which, as Karen was saying, like the education is so important because we really find that with knowledge, like knowledge is power. So once people know, why am I taking all these different medications?
Yeah.
What are they doing for me? They're more likely to be compliant with the medications, compliant with the program when they feel that they're being supported. And then we can encourage them to do more activity at home.
Yeah.
Right.
What do you say to someone that there's a lot of individuals that feel like any medication I bring home, it could be even my vitamins that I take every single morning. You know, my mother-in-law, who now lives with us, looks at everything and researches it and says, man, this feels like it's more dangerous for you to take than just not taking it at all. So what do you say to someone that says, if you're going to prescribe them medication, that this is definitely long-term going to be very beneficial to you? Because a lot of people are going to the internet as like the golden book of rules on why I shouldn't take medication. I hear this constantly. Well, doctor prescribed this, but I'm not going to take it. You know, in the background, what do you say to someone that's saying that?
I think, again, anytime I have patients that will come to me and be like, well, I don't know. I don't know why I'm taking that. I don't know what, and Google told me this, Dr. Google. I really, really just try to educate them and give them statistical information that can back up why we want them to take these medications, how it will prevent further infections, how if they take their controller medications, they may not need their rescue medications, which is common terminology with respiratory illness. If you take controller medications as prescribed, you may not need your rescue. I know here generally people call them pumps, but they're like inhaled medications. And just going over how this can help improve their daily life. So at the beginning of the program, we often ask, like, what do you want to get out of the program? What are your goals? And then we try to see how they, with the proper management of their medication and attending the exercise program, how we can kind of get them closer to those goals, playing with their grandchildren or whatever it might be, doing their own grocery shopping, be able to maintain that independence with the help of the medications.
Yeah. And you don't, guys, I want to ask this, you don't push this, right? Like when somebody's having a problem with shortage of breath, I've found that a lot of people and this is so awesome that you guys are here because the awareness is coming up next week too. And we'll talk more about that. But I've always seen, I'll give you an example, an instructor at a gym. Somebody might say, man, I'm out of breath. And the instructor's like, no, let's push through it. Let's push through that. I just kind of want to change that narrative now on the radio because I always felt like that sounds off. That person is just saying they're out of breath. That's a very crucial thing. So can you not push them that way?
No, that is why it is supervised.
Yeah.
It is a supervised program. So a respiratory therapist and a physiotherapist is in that program with you. This is a program that has a multidisciplinary approach. So you're not going to, prior to the program starting, we also have pulmonologists involved in this. Yes, we have our dietitian. We have our physical therapist or our physiotherapist. We have our respiratory therapist. So it's multidisciplinary approach. And because it's supervised, it's a medically supervised program, the respiratory therapist with their expertise although the physiotherapist is there giving the exercise, this is where the respiratory therapist would step in because they are monitoring the patient.
Yeah.
And we're not just monitoring the patient just by looking. Sometimes we also have to check what we call their oxygen saturation. So we have a special machine that's checking the level of oxygen that is in their body right now. So if they're short of breath and we see that level drop, then we know that it's time for them to rest.
Okay.
So maybe this round we allow the others to go through, but we can't allow you to go through. So after this round, you may recover, and then we start you again. So that's why this program is so important, because it is not just that they're going out there without persons who are not knowledgeable. The respiratory therapist is clinically knowledgeable, have spent several years studying on respiratory condition, and so they're supervised. And so they step in to say, okay, how are you feeling? We're asking the patients, we're seeing how they are feeling as well, because we want to empower them and to make them have control over themselves. So we'll be asking them, how are you feeling? I see you're a bit short of breath. All right, how does that feel? It's time to maybe have a rest. So anything more you want to add, Holly?
Yes. This is where the education component comes really important. We teach breathing exercises to help with shortness of breath, as well as to help with the anxiety when you do become short of breath.
Yeah.
As well, we really educate the patients on pacing themselves so that you are able to complete your activities of daily life, how you pace yourself. So we give them a scale, it's called a Borg scale, and we estimate their level of shortness of breath. And we tell them we never want, we'll give a scale of 0 to 10, where 10 being max. 5 is as much as we want them to be shortness of breath. This is a disease of the lungs.
Yeah.
So we really want to be mindful that they're only sitting about 5 during the activity. And they may be able to continue to contribute or participate, but they just have to pace themselves. Maybe they're doing the steps, but they're taking them a little slower. They're going at their own pace. So that's why we're there, just to really make sure we don't want anybody to become so short of breath that they don't feel comfortable at the program, right?
Yeah.
Yeah, so we very much supported, and we watch them throughout the whole thing.
It feels that way.
Yeah.
12 weeks too. And after that 12 weeks, is it basically just, you're consulting them and say, hey, this is a lifestyle now. What we showed you over these 12 weeks, we hope that you will, you'll take it in and you'll implement it into your life.
Absolutely. And they're encouraged to work up to doing 30 minutes a day at home in between the days of the program. So that may look like 10 minutes 3 times a day, whatever they're comfortable, and they will work up to the goal of having 30 minutes a day. And the exercise can include flexibility, breathing exercise, endurance, as well as strength training or resistance bands. So all of those are very important for your lung development and strengthening the muscles in your lungs, like your diaphragm.
Yeah, I love that. Human beings naturally don't like being alone. So as soon as they go back into their natural habitat and they're like, well, I'm taking on because, Dr. Holly told me what needs to be done. If they ever want to reach back out and, they're just not comfortable yet and they're scared, do you guys offer an extension in that program? Or is it pretty much, no, we've showed you what needs to be done. We reinstate that message again and it goes on.
So yes, they can come back, and we have had that in cardiac rehab.
Yes.
Where we're finished the 8 weeks, and the patient continue for another 8 weeks. They're, this is good, and I'm seeing the benefits, but I don't feel like I'm there yet. Yes.
Yeah.
So that's something that they can have a discussion with the respiratory therapist and their physician to see maybe they need an extension to that, and we can certainly facilitate that. So.
Yeah.
I love that. We're going to take a quick commercial break, and we'll be right back. All brought to you by HSA. Welcome to Bobo.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
Welcome to the show. It's Bobo, all brought to you, of course, by HSA. Very special segment. We're talking about a very special program here. And we have two special individuals here from HSA here to talk about a brand new program here, just introduced in December. We're going to break down the details, but Holly and Carol, did I say that right?
Yes, Karen.
Karen, yeah. I want to make sure I get everybody's name right. They're from HSA and the new program. Ladies, can you talk about it one more time? Just a quick overview of the program for listeners that are just joining us for the first time. And Holly, we'll do it with you. Yeah.
Okay, so it's a pulmonary rehab program. The program itself runs for about 12 weeks. We do weekly education sessions and 3 times weekly 1-hour exercise, which is supervised exercise. It's run by myself, a respiratory therapist, and a physiotherapist, and it's overseen by a pulmonologist. It's for people with stable chronic lung conditions like chronic obstructive pulmonary disease or pulmonary fibrosis.
Love it. And we were talking about the 12-week program and just what it consists of. Seems to be exercise is the fundamental part of this program. And with that being said, I want to ask this question, how does exercise help with people with chronic lung disease? A word that everybody seems to run away from a lot of times when they hear exercise. But how does it help? I'm sure it's very helpful. So explain that.
So exactly. The exercise component is really important, and the education to keep them informed on why we're exercising and how to cope better with exercise and pace yourself. So the exercise helps to strengthen the breathing muscles, strengthen the diaphragm, helps to improve endurance when we go over breathing exercises, which can help reduce breathlessness. We often find people that have chronic lung conditions will avoid exercise because of the shortness of breath. So we want them to be encouraged to continue exercising at home as well as in the supervised environment. So we teach pacing methods and techniques to manage their daily activities at home. This can help prevent hospitalizations and improve their overall lung function.
Yeah. What is overdoing it like for an individual that's suffering with this disease? What is overdoing it for them? Is it going outside and playing basketball with your son, or playing tag football, or what is it called? Not American, but it's rugby.
Rugby.
Yeah.
So it's very individualized, right? So for everybody, what's overdoing it might be a little bit different. So we do a proper assessment of the patients when we first meet with them and see what causes them to have severe shortness of breath or moderate shortness of breath. We want to always have them maintain like a 5 out of 10 on a scale of shortness of breath during the activity. So yes, playing rugby would probably be anybody with a chronic lung condition, but we are looking at being able to have them go for short walks with their family, be able to play with their grandchildren, do their own housework. Those would be the goals where we're trying to get.
I love it. Anything you want to add to that?
No, I think Holly hit the nail on the head. Is that we want to empower them to be able to manage simple tasks that they no longer could find themselves not being able to do.
Yeah.
Because they become so breathless. So we want to teach them how to manage and how to pace themselves. Yes, because maybe I could do the laundry this morning, but I can't do the laundry and clean the house on the same day.
Yeah.
So what does that look like? Or maybe I can play with my grandchild. I could maybe play hide and seek. Yes, but I can't play football because that's a bit too much. So it's helping them to understand what does pacing looks like for them. So as Holly says, it's very individualized. It depends on your chronic lung condition, the stage that you're at in that lung lung condition. Because I have COPD, but you may have something that is my COPD may not be as bad as your COPD. So so that's why the patient has to see a pulmonologist and do a series of tests, and we do clinical assessment so we can individualize the care. Even though it's pulmonary rehab, we want to individualize that for each person because each person is an individual.
Yeah. Wow. So good. So good. And for those that don't know, a lot of times when we get a lot of doctors here on this program that's brought to you by HSA, we tend to talk about age. Like you kind of feel like, well, this is the age that you need to start looking into things like this. But this seems like it doesn't discriminate. Like this can be anyone, right? So you'd speak about that more. Like this, even if you're looking on it from a child perspective, like what are we looking out for our kids here? Like if we see this happening with our kids, like what should we be what are the signs?
For children, especially with shortness of breath with activity, or if they have respiratory illnesses and they tend to get like really chest colds or shortness of breath with, if they come home and say, I'm short, I can't breathe when I'm in gym class or things like that, you may want to talk to your physician and have them come in for a breathing test. We do breathing tests on children over 6 because they may have a reactive airway. It might be an allergen in the home. I don't know what else.
And they could have been diagnosed with asthma.
Oh, yeah.
Or
yeah.
maybe they have asthma, but they don't know yet
Right.
that
Yeah.
they have it, right? They just the parent may hear them wheezing and just thinking, why you wheezing?
Yeah.
Yeah.
You know, because maybe something triggered that, and it is not very obvious to them. So in those cases, even though you're saying, but you're a child, you shouldn't know. There may be something underlying happening, and unless you go seek help from your physician, then who can do further testing, then you're not very sure. But remember now, that although you don't find in children a lot of respiratory condition, I mean, yes, asthma is one of those, but something can be happening and you're not aware.
Yeah.
So you want to make sure that if you have concerns, that you do visit your physician and seek the help that or at least clear that child. And it doesn't discriminate at all, because as you know, young persons as well do smoke, and some smoke like a chain smoking, and we're finding that even for young persons, because of that chain smoking and other things, they're coming up with respiratory conditions, and they're like, but I used to could run, so far, and I can't run anymore. So that is why the pulmonary rehab program doesn't discriminate. We have had young like a young person in ours, like maybe she was about 20, because she had another condition that was causing her to have respiratory problems, and we just had to monitor and help her through and increase her endurance. So it could be happening at any age. Yes, it's maybe more frequent in older persons, but it doesn't discriminate against age at all.
Yeah, it's just scary when you're talking about it when it comes to kids.
Yeah,
'Cause I think a lot of times parents just brush it off. Like, it's going to be fine.
especially with the increased use of like e-cigarettes or vapes. I think we're going to be seeing more and more younger and younger people coming in with the lung conditions because they're vaping more frequently, I think, than they would use a cigarette. Even,
Yeah.
right?
And you don't know a lot of the times, too, because there's no,
Yes.
well, maybe pardon my ignorance on this, but I don't know if there's a certain scent when after a child is vaping, because I've realized just how much this is being done in the schools now. Right. And as parents are trying to keep aware of it, because back in the day, you can smell if you're a child, because they probably put on way too much cologne, or why are you overeating that chewing gum? Right. That's a lot of chewing gum you put in your mouth. But I don't know if there's a scent when it comes to e-cigarettes. So a lot of parents can't even tell, because that's destroying their lungs too. And they don't know it because they're doing it. Kids are doing it now because they feel it's a safe alternative, which is not.
No.
Which is not. I think we'll talk more about that in the show. But there seems to be a lot of education in this 12-week program and the sessions. What does it include? Can we cover what form of education will be done in this program?
So the education component, there's 12 different topics that we'll cover. The goal is to give the patient the knowledge for self-management at home and to be more confident in managing themselves. So some of the education topics would be nutrition, medication management, energy conservation with exercise, oxygen therapy, and their emotional well-being, how to cope with the stress and the anxiety that can come full circle with shortness of breath. One of the nice parts of the program as well is small group sizes. So usually during the education session, like I'm open to questions. If they have individual questions, they can like stay after if they don't want to ask in the group. But normally everyone engages in a group discussion, and it really helps them feel supported and not alone in their disease.
Love it. Love it. I see here that you have special even sessions open up to patients, family, and to the public.
We want to talk about that.
Yeah, let's jump into that. It looks intriguing.
The respiratory therapists have these special weekly education sessions, and we do invite the family members, whether it's your spouse or maybe your significant other or the caregiver, to join the patients in these family sessions, because in these education sessions, if the family is also aware of what to expect, when it's happening, that's a second pair of eyes or a pair of eyes that is also noticing that something is happening. And they can seek or they can say, we were taught this. I think we need to maybe seek some help, or we need to do this, or, something is happening here. Let us call and find out what is happening, or let us investigate further. So knowledge is power.
Yeah.
We do know that. So we want the caregiver, we want the spouse or significant other, or anyone that the patient choose to bring along at the education sessions themselves to come along, and so that they can also learn the things that the patient is learning to improve their health, yes, and to prevent them from having to do readmissions. So that is what those sessions are.
Accountability partner, I like to call it. Like, it's because I can't tell you how many times people will go to a doctor. They know what's the right thing to do, but they're not accountable to their own health. So to have somebody else there,
Yes.
that's just gonna just be there as a second, like you said, a second pair of eyes. Like, because a lot of times I'll bring up something too. I give you a perfect example. Like my wife, I'll just normally say, and I said, I think I need to rest. And she's looking at me like, is this rest, or you just trying to get away from something? So I think the education behind just knowing what this is and how to prevent it becoming something serious or even worse. I don't want to use the word, but I think you guys know where I'm going with this. Like, it leads to obviously expiring. You don't want anything bad happening to your loved one. So I love that you guys have incorporated this family session. It's really important, and you urge. Obviously, this is a part of the practice. Do you urge family members to come out and take part?
Yes,
That's good.
Absolutely.
Love it. All right, there's a lot of stuff for us to discuss here, so I want to get through to it. But I'm learning so much. We're going to take our time with it. But I want to know who is eligible for this program. That's what we're looking for. I think we asked this earlier, and I think it was a very important question because it scares me now. When I walk up that stairs, I'm like, well, I do feel kind of out of breath. Am I qualified for this?
So if you're wondering if you were qualified, it's best to talk to your physician. You'll be referred by your physician. So the people that are qualified would have stable chronic lung disease and who experience some degree of breathlessness. As I mentioned earlier, like that could be breathlessness with while you're hurrying or walking up an incline or walking up a flight of stairs, and then you also have a chronic lung condition, a diagnosis of one. You must be able to walk at least 5 meters with or without an aid like a walker or a cane. So you were able to use that for the test, and able to participate in a group setting and follow simple instructions. If you're not sure if you have been diagnosed with a chronic lung condition, again, if you go to your physician, they can send you for the testings. They can come to us and we can perform pulmonary function tests, and then we can determine if they would qualify for the program that way.
Love it, man.
Yeah.
This is very informative, ladies. We'll take a quick commercial break, but we'll ask this question first before we get into a next break. What kind of results can patients expect from this program?
So patients and their family members, because that's very important.
Yeah.
Yes? They can expect improved ability to perform daily tasks. Their daily activities. So things that they would like to, they're washing as a simple walk to maybe play with their grandchildren or their children. So also, this is very important. Reduce the hospital visits and complications.
Yeah.
Yes. So if you with the program, what we should be seeing for patients who are following the program and doing the things that, and also the education, is that they shouldn't, if they used to go to the physician every 2 weeks, we're hoping that with this program, we should be seeing them going less because of there's not a complication. They're using their inhalers properly. Yes, they're not overexerting themselves, and then they're wondering what is happening to me. They're also understanding the signs and symptoms of their condition, yes, and what to look out for. So also, this is very important. Increase independence. Everyone wants to feel independent and to be able to do things, and as well as feeling independent, to be confident as you're doing the things. That listen, I can do this now because I know how far to go.
Yeah.
And so that is important. You want to empower them to be able to look after themselves with this chronic condition. It may never go away, but you should be able to live a stable life with it. So that is the hope, and actually that is what the program is geared for, and that is why we ask the patient when they come in, what is it that you want to achieve, and then we're going to work with you to achieve those results. Of course, if it's something that we know you cannot achieve, we can speak to you on how you can achieve something near to that or similar, because it depends on how advanced you are in your in your chronic respiratory condition.
Yeah. If you patients may come by and say, because I like what you said at the end, this may not be something that goes away, but we're teaching you how to live with it, which is really important. But what if a patient does come to you and say, hey, I'm ambitious. I have a bucket list of running a half marathon and I want to do this. Is that something that you enable them to do eventually? Like if they want to take on a lifestyle like that, or is that pretty much gone if they have this form of disease?
I think it depends on the individual and also how advanced their condition is. Just because I have COPD, it doesn't mean that I have very advanced. As well, you might have somebody who is really at terminal or end stage. So it really depends.
And you'd have to see if they're properly managed with their medications. Like, how have they been managing? Have they not been taking anything? Because sometimes we can see people that have not been taking their medications as prescribed. We have them taking them as prescribed, and then we might see a normalization on some of their breathing tests. So, like Nurse Karen said, it's very individualized. I would absolutely never say, like, no way, you can't do that. But we can talk to them and work with them to see what might be a good goal for them. Right?
I love that.
Yeah.
Absolutely love that. All right. So we are talking to HSA, brand new program. Ladies and gents, if you're just joined into the show, we're going to take a quick commercial break. We're going to come back and we're going to have more discussions. So don't even think about touching that dial. We are Bobo.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
And we are back. Welcome to Bobo. This segment is all brought to you by HSA. A pleasure to have two very special individuals here in the studios. I think we found out during COVID just how important breathing is. I think that's what everybody was saying. Man, this is a very important thing to have. and let me keep this going in my life, because nobody wants to experience that feeling of like, I'm out of breath or I just can't breathe at all. So this program is very unique, and I'll give some insight. Don't worry, we're going to give an overview for the listeners that just joined for the first time. So anyone can give the quick overview of what we're talking about. What is the new program to HSA, and how can our listeners benefit?
So on December the 2nd, 2024, the HSA launched a new program, and the name of that program is Pulmonary Rehabilitation Programme. And this program is a 12-week program. It is designed for patients with chronic stable lung diseases, so like COPD, interstitial lung disease. And the aim is to help our patients to breathe better, to strengthen their breathing muscles, to reduce the complications that they may end up having because, things are not happening the way or they should, and to improve their quality of life. It's also wanting to make sure that it increase their independence and also their confidence and even their social activities. So that's the aim of the program. The program so far has been going really well for those who are in the program. So we want to let the entire Cayman Islands know about the program, and if you find that this program might help you, speak to your physician, and then from there we can take it from there.
Love it. Now we spoke earlier too, guys, ladies, just about the support factor, like the support that you guys offer. Obviously, it's out for 12 weeks, which was just mentioned. But then there might be individuals that come back and say, hey, I still don't feel confident with doing this by myself. But let's just say these individuals have support, like their family. and they may go as far as getting a caregiver, depending on the age. Now, how do you guys at HSA support families and caregivers? Is there support that's given to them? So that way, if somebody's walking off saying, I need you, it's more than 12 weeks for me. Maybe there's somebody in the family member that said, I'll take the training. I'm gonna be there for them. I'm gonna support them. That's gonna be their accountability partner. Do you guys offer that support to those individuals?
Yes, absolutely. So we would encourage family and caregivers to come to the education sessions so that they can be informed in how they can best support their loved one in their chronic lung condition. We give them tools to assist their loved one at home, how they can help to monitor their shortness of breath, how they can help to encourage them with their breathing exercises. We want the families and the patients to have an enhanced understanding of their lung disease and how they can best be supported. For those patients that if they've gone through the 12-week program, we always encourage them to participate in home exercises at that time while they're in the program, so that if questions come up, they can ask us. And if they feel that they are not ready to stop after the 12 weeks, we can always look into other options of how they can continue with us if possible.
Love it, man.
Yeah.
So families can get involved. Caregivers, you can stand firm knowing that you can contact them anytime in order to get some advice around this, and just how you can support anybody that's living with this disease. Doesn't mean it's that life is over. Just means that they have to live a complete different lifestyle, right?
Absolutely.
And diets, things like that may have to change depending on just how aggressive it is. We were learning a lot from this, and this is a very good program that's coming to HSA. I'm so glad it's open now, and once again, you do recommend that a physician recommends them to come to you, right? Or can they just call you guys directly and say, no, I want to make the appointment. I feel like this is happening to me. This is certainly something that I'm experiencing, and I want to make the appointment myself. But do you guys recommend they go to their doctors first?
We do recommend that there's a referral from a physician, because there are some tests that would have to be done to see if they qualify for the program. That would have to also be sent by the physician. But we do welcome general questions. Do you think this might be right for me?
Yeah.
If they're just curious about their lung disease and if they think that they should contact their physician, or if they just have general inquiries about the program, we're happy to help and answer any questions like that.
I love it. All right, so this looks like it's just in time. You guys are here on the show, but as of next week, March 9th and 15th, the awareness month is amongst us. So talk about more just about the awareness and why this awareness is so important to the island.
So the American Association of Cardiovascular, they recognize Pulmonary Rehab Week. It's next week from March the 9th to the 15th. And this is important. And you might be asking, why is awareness important? Well, it provides an opportunity to highlight the impact of pulmonary rehabilitation. As we said before, the aim is to help patients to breathe easier, increase their confidence, and to make them feel independent, increase their social activities, and improve their quality of life. So it is important that patients and their family members understand that early intervention and lifestyle changes can do all of these things, and pulmonary rehabilitation can significantly improve a patient's quality of life. And I think everybody wants that. They want improved quality of life. And so this is what this program is all about. It's about seeing how we can improve your quality of life by through education and these exercises. What does pacing look like? And to also make sure that you're feeling as if you're living your best life.
Yeah.
Maybe with a condition, as I said, the condition may never go away. So how do you live your best life with this chronic lung condition?
I love it, man. So good. So good. And I think there was a question that was on top of my head, doctor, that I wanted to, nurse, that I want to ask was very important. I know a lot of times there's different resources that individuals can use to read about this. Is there conferences that are held? Are you guys doing anything special on March 9th to the 15th that the public can get involved with just to learn more information?
So that is why we're on this program. We want to alert the public that this program is happening. And of course, if you want to know more about the program, besides what you're learning from here, if you want to know if it's right for you, as Holly says, feel comfortable to call us on 244-2759. It is important that your physician is also involved, because unless we do certain tests, then you are not fully, or even your physician, we can't say if we can't confirm that you have certain chronic condition. Maybe you have it a long time, but just didn't know that you have it because you have never been tested to rule this out or to see, what those tests are. So that's very important. So we are available Monday to Friday from 7 to 4:30 p.m. And we are available on 244-2759. Sometimes the respiratory therapists are out seeing patients, quite busy. But if you leave a message, we will return the message. Or you can even email us at respiratory@hsa.ky. We will also respond that way. If there's a private physician out there who is listening, or a private office, feel free to either email us or call that number, or to send your referral through that email, and we will take it from there and follow up with the patient. We will contact the patient. We will invite them to come in. We'll also encourage that a pulmonologist see this patient as well, just to make sure everything is in order. So that's very important.
Love that.
So yes, you will be seeing things happening around the world for pulmonary rehabilitation. But if you feel that you need more, just reach out to us. We're happy. We are here for you. We do care for you, and so we want you to know that.
And I think you kind of ran that down, like you basically gave the last message there. But any other encouragement from you, Holly, that you would like to give to anybody that's listening, any future patients, any word of encouragement, how this can change your life? Just probably just like a 30 seconds way of saying, hey, this could improve your life, and this can be helpful.
Yeah, so taking the first step is the most important. Reaching out to us if you have you're encouraged to reach out to us if you're struggling with shortness of breath. Again, this program is about regaining your independence, improving your daily life at home. You're encouraged to call and find out more information. We're always happy to answer any questions that you have.
I love it. Now, for those that are listening right now, welcome to Bobo, by the way, special program from HSA. But if you want to call and you want to sign you and your family up or just know more about the program, the number is 244-2759. That's from Monday to Friday from 7 a.m. to 5 p.m. Or you can email. Can you guys give them the email address just really quick, just so they can email, maybe those that prefer to email versus calling?
Yes, the email is respiratory@hsa.ky. So that's respiratory@hsa.ky.
I love it. Any encouragement for people that have taken the program since it started or are considering to take it right now? Any last minute things between you two that you would like to say? Just some words of encouragement, just to make sure that somebody who's still considering picking up that phone and sending an email, this is going to be the final words that's going to make them do that today.
So we have several patients in the program, and they're loving it. As Holly said, one has said that he just can't leave right now.
Yeah.
So we will have to, to increase. And sometimes you want to hear from somebody. So if you feel as if you want to do that, you can reach out to us, because we can ask them to speak to you.
Yes.
If that we'll ask their permission. But you can also go online and hear what people who have been on the program say, from other jurisdictions. So it's not just Cayman Islands that this is happening. This happened all over the world. It's just that it's the first program to Cayman. Yeah. So a lot of people love to go on Google, so you can research that as well and see what other people say about pulmonary rehab. How is it, beneficial to them? And you can get that as well. And certainly, if you feel as if you need, you're just so unsure or you're scared. Sometimes you know what you need to do, but you're afraid to take that plunge, and you would like to hear from somebody who maybe is in it. We could definitely contact us. We can definitely ask permission. Of course, patient confidentiality is very important to us, so we would have to gain permission before we, do that. But our patients, I think they will be happy to even speak, to somebody one-on-one, because they themselves are enjoying it. But as I said, we'd have to ask that permission, because patient confidentiality is quite important. But failing that as well, you can go online and have a look. It is right out there in the media for everybody to see.
I love it, man. Ladies.
Some of the feedback that I've had from my patients has just been, they just absolutely love the socialization and getting out. We have fun. We listen to music. We make exercise fun. We have laughs, and they really feel that they've learned a lot education-wise since starting the program. So they're very, very pleased with it.
Wonderful. It seems like it's something that if you're overthinking it, there's no reason to. It looks like there's way more benefits than any reason for you to be scared to join this program and to be recommended for it. All right. I want to thank you, ladies, once again for stopping by. Anybody you want to shout out and thank at the HSA, or that's pretty much it. That's a wrap up for you guys, ladies, right?
So I want to give special thanks to Rachel Nesbitt. I'm not sure if she's listening to the program, but she was one of our respiratory therapists.
Yes.
Just like Holly, and we work on this together. And of course, as Holly came in over a year ago, we were able to work along with Holly. And just want to say thanks to the marketing team at the HSA. They really, really helped us on this as well. There was some portion to it that we needed their assistance. And I just want to thank the hospital in general, our CEO, and our senior management team, because they have facilitated this program. And special thanks to the physiotherapist department, Raquel, who is the manager.
Yeah.
She really went all out to say, yes, you can come, we will facilitate, because that's a big part of the program as well. So we want to say thanks to everyone who have played a part, our pulmonologists as well. Even a simple thing as our IT department, you believe it, yes or no, they did our documentation portion for us. So as you can see, we need a village to really make something successful.
I see that.
We cannot be standing alone. And I just want to say thanks to everyone, our patients who are in the program right now. Thank you. You're our first patients. And the fact that it is helping you is really encouraging for us. You were very happy to come on board, because you realized that this was going to be important for you. It was going to improve your life. And that is really important to us. At the end of the day, this is all about our patients, right? Just giving them what they need to improve their lifestyle and to improve their life overall. So thanks to everyone who have some part in this, who have done something to make this work. Thank you very much.
Ladies, we
thank
appreciate
you also for allowing us to come here to just tell Cayman Islands that this program is here. It is here for them. And if they think they need this program, just get in touch with us. And we're very happy.
Let me tell you, it was very beneficial. So a lot of knowledge and something I needed to hear today, too. So I really want to thank you for being a part of the show, because it was very informative. So thank you once again for being a part of the show. It's all brought to you by HSA. Thank you, ladies.
Thank you.
Thank you so much. Have a great day.